This is a continuation of the provision of information that is going on in our country regarding the pandemic that the whole world is dealing with at this moment, that of coronavirus. A lot of information has been regularly getting out from the World Health Organization, from different countries, health systems, including the health care system of Uganda. I've felt it necessary to add on more information because I have a sense that there is a critical area that we are not focusing on yet in our country and directing our effort and resources to those areas. First of all, dealing with viruses in general is a complicated thing because viruses are particles, or viri, or viruses, as you may call it, are particles that change nature all the time. And that is why it's very difficult to have treatment for any of the viruses that afflict us human beings, that afflict plants and afflict all kinds of living organisms. Now, the focus of the world has been more on dealing with the spread of the new virus, the coronavirus, to make sure that its spread is curtailed and therefore its effect nullified. And I associate entirely with the measures that have been provided by the different sources of information. As I have said, the World Health Organization, the health care systems around the world have been providing very useful information on how to control the spread of this virus. Just to recap, it's important to appreciate that this virus spreads through the droplets of saliva or fluids that come from a person, maybe through sneezing or through coughing, and droplets containing these viruses then go to the next person. They drop on you and develop a disease on you. And where they drop and can develop a disease is also limited. It is only on the fine lining of our inner skin that is called the mucosa. That's the only place where they seek and gain entry, within the mouth and throat, or within the nose, or to some extent the lining within the eye. This is where these viruses enter from. They come from sneezing, from coughing, and gain access to the next person through those entrances. Now, if they don't gain access direct from one person to the other, they gain access through staying on surfaces where the infected person's saliva droplets go. If I cough or if I sneeze, droplets will go on this table. If you touch the table and touch those surfaces I have talked about, then the virus gets to you. So it's not very difficult to stop the spread of the virus itself if the measures that have been, provided are followed. Most especially the washing of hands very frequently. Because if you get the virus from any surface and you wash it off, you are okay. And to avoid touching areas where it can gain access to your body. The mouth, the nose, the eyes. If you stop that, you are safe. But having said that, and looking at how to control the spread, some of the measures that have been given, I believe, are incomplete if you don't facilitate or assist people to achieve them. For example, an order has been given for all schools to close, all institutions of learning to close. That's a good initiative to stop congregating of people, because if one of them is infected, very quickly can infect very many. But if you want those who are in schools to leave schools and go home, it's also important that they don't do so in a panicky way, to move at a go, because then that mass movement of people can in itself cause a problem. So I would advise that even as our children are going back home, they should be phased. Maybe they should start with one class goes home today, another class goes home tomorrow, another class goes home the other day. That will help reduce the scramble of people as they try to leave and go all at the same time. Secondly, it's important that when we talk about people washing their hands, we facilitate them to do so. We are taking water for granted, that it's available to people, clean water. But clean water in these towns and places where we live can be very difficult to come by because it's costly. I would therefore, in that regard, recommend that steps be taken to make it easy for those who need inputs to keep them safe to get those inputs. The role of government is to make sure that all people are covered. Government has the role of balancing the boat of the country so that those who are deprived, their deprivation can be reduced. Those who are very well off help to cover those who are deprived. So I think it is very important that domestic water supply during this time is not restricted. That the national water, fortunately, national water is still a public body, that national water does not turn off people who have not paid for water. That national water does not send bills at this time for people to get water, so that water is freely and readily available to all Ugandans. That is extremely important. It's not enough to say people should wash when it is very difficult to get clean water. Similarly, I think power should not be turned off from our people at this time. Again, government can and should put in place measures to make sure that domestic power remains available, so that water can be boiled, so that there can be cleaning of places and maintenance of homes in hygienic conditions. Thirdly, we are talking about people having soap, to wash with soap. But our people are hurting. Those who can afford soap are few. It's therefore important that measures are quickly put in place to the extent possible to make soap accessible to our people. And this is what I would recommend, that until this crisis is out, taxation on soap is abolished, so that we can get soap at the lowest price that is possible. Secondly, where people have to go and where they need to wash with soap, we should not expect that our poor people are going to provide that soap to the extent that is needed in the places where it is needed. It's one thing to say people going to the market should use disinfectant before they enter the markets or whatever. But who will provide that disinfectant? Because if you just leave it to the markets to do so, the next thing is we are going to have people just supply water or supply some substandard material to fulfill just the requirement. If you come inspecting, you see some people washing, when in actual fact, they are not being protected. So I think it is important that for public places that have to remain open and where many people go, the state must pick up the bill and get the appropriately tested materials to be applied in those areas in the quantities needed for our people to maintain the necessary hygiene in those places. Similarly, taxes on disinfectants should be abolished for the time of the pandemic. And there are several useful disinfectants like Jik. Jik is a very good disinfectant that can be used and has been used over time to protect people. And it's readily available, but it's not affordable. So disinfectants should equally attract no taxes at all. Now, one of the things that is difficult to control in the spread of this virus is money. Uganda is a cash economy. You, in a short time, will handle paper notes that have come from a landing site somewhere on Lake Victoria that came with a fisherman who gave the paper to a marketman. Marketman brings it to the shop. The shop brings it. In a short time, money changes many, many hands. I think measures to reduce the use of money will be helpful during this time. To that extent, it would be wise and recommendable that we make it easy for people not to use paper money. So the cost on using maybe cards to pay should be adjusted, removed, so that people can pay, those who are able to pay with cards can pay with cards. But secondly, mobile money should attract no tax during the crisis, so that people can transact and use mobile money without fear of losing the value that they are transacting with. In the same vein, if we don't want people to congregate, to get together, we should make their communication easy. So let's, for the duration of the pandemic, scrap tax on internet. The OTT should go so that people can more easily and cheaply communicate rather than looking for each other to talk physically. These are some of the measures that I consider, on top of what has already been communicated, will help in minimizing the spread of the virus. But the spread of the virus is just one thing. The next thing, which is far less focused on, and which is the main reason for this communication, is to understand that disease can be around or illnesses can be in the country, but people may be more resistant not to suffer from them. So we have not focused on how our people are able to resist getting disease. Not all that are infected actually get disease. It is one thing to be infected, it is totally another to contract disease. We are always being infected by all kinds of things, but we don't go down with the disease because we are able, our bodies are able to fight, fend off those infections without us being aware that we have even been infected. So, when our immunity is high, the threat of infection is, and the results of that infection is much less. Now, regrettably, Ugandans, the immunity of Ugandans is greatly challenged. Of the majority of Ugandans is greatly challenged. And I will just quickly say what challenges our immunity so that you may understand why our immunity is challenged. Now, before I talk about what boosts, what helps to increase our immunity, let me just talk about what undermines immunity. Some of the very normal things that we don't often focus on are critically important. For example, sleep. If you don't have enough sleep, or if you don't, your sleep is not in a regular cycle, that when it comes to time to sleep, you sleep. When it's your time to wake up, you wake up. So enough time to sleep and the regular cycle is very important for immunity. An adult needs about 8 hours of good sleep every day. 8 hours. If you fail, maybe you should have at least 7. If you are only having 6, you are not having enough sleep. But quite often, many of our people don't even get 5 hours to sleep because of the hassles they have to go through. And indeed, even when some go to bed, they remain awake until morning because of the problems that face them. That greatly undermines immunity. This is why I'm saying that the majority of people in Uganda have low immunity. Secondly, stress, stressful conditions, stress coming from all kinds of pressures around us. Like now, it has all of a sudden been announced that you must collect your children from school. but you are not prepared for this. You have no money. Your child is going to be crying alone at school. You are stressed. So stress is, we have immense stresses that people live with in our country. There is no food at home. No rent has been paid. No, job. You don't know where to, how to survive. The kinds of pressures that we live with are enormous. This inherently undermines immunity. Third, smoking. Smoking can, of course, be said to be voluntary, that you choose to smoke, and that is the case. But once somebody is smoking, it's not easy to get off. That's why they call it addiction. They need help to get off smoke. Somebody must provide help. It's a medical kind of situation. Somebody needs treatment to leave smoke. But smoking greatly undermines immunity. And we have many of our people who smoke. Indeed, some of our people say that smoking helps to reduce their stress. So already they have stress and they are smoking. That greatly suppresses their immunity. Third, or fourthly, alcohol. Alcohol, again, just like smoking, can be quite addictive and negatively impact on our immunity. Lack of exercise. Exercise is very important for immunity because the cells in our bodies which are responsible for immunity are in a system that is called the lymphatic system. Just like we have the blood system, we also have a system of white cells, of white blood. That white blood, unlike the normal blood which is pumped by the heart, the white blood is pumped by the muscles. So if your muscles are not active, it means that the circulation of the cells that you need to keep you defended from infection is undermined. So exercise is very important. But again, quite often, our people don't either know, or even those who know don't have the opportunity to do exercise. Some are seated in offices for very long hours, and from there just go home and sleep and so on and so forth. Now, sugar is one thing that some people don't know, many people don't know, that sugar undermines immunity. Taking sugar is actually, the sugar we put in our tea, the sugar which is everywhere in our foods, in cakes, in all kinds of things we like to eat, undermines immunity. And if you take sugar, like 30 minutes up to 5 hours after taking the sugar, there is great suppression of the effectiveness of cells that protect us from disease. Now, of course, happily, there are many people who can't afford sugar, but there are also many who look for it and poison themselves with sugar, undermining. So in this situation where we have this kind of pandemic, it's important that we lower or even altogether avoid taking sugar, which lowers our ability to destroy the cells, to destroy the agents that make us sick. Now, there are many other things that affect immunity, but I wanted to bring this. Others are like genetics. Genetics, there is not much that you will do about them. Some people are born more able to resist illnesses, while others are not. There isn't much that you can do about that, and there are many other cases. But for now, apart from These cases which I have talked about and which I will come back to at the end, I would like to talk about what improves our immunity so that we look for those things that can improve our ability to fight against these diseases. The first one, and very natural again, is what we eat, the nutrients that get into our body. This is very, very important. Again, part of the reason many of our people have low immunity, because our people don't eat enough and don't eat even then the important things that help immunity. So it is important to eat enough balanced food, nutrients, to get nutrients. Now, because of time, I will just focus on the nutrients that are most critical for immunity. The first one are the vitamins. Vitamins are extremely important for immunity, especially vitamin C. Now, vitamin C is widely talked about, but some people, again, may not know where to get this vitamin C from and its vital importance. Now, vitamin C, fortunately, is in a lot of fruits. If you eat fruits, most of the fruits, you are likely to get vitamin C. A small rider, fruits also contain a lot of sugar, which I talked about, that reduces immunity. So again, it's important even when you are eating fruits, not to eat a lot of fruits that will raise your sugar. So this is why lemons are very, very good for provision of vitamin C. If you take just one fruit of lemon a day, it can provide enough vitamin C for you for a day. So, depending, of course, on the size and how good it is. So, but we can talk about 1 or 2 lemon fruits, very good. So, lemons are a good source of vitamin C, and equally citrus fruits. The grapefruit is very important, it's very good also. It doesn't have a lot of sugar. The orange, the normal orange, unfortunately, is good for vitamin C, but it also has quite a bit of sugar. Mangoes are good. Guava and mapera are very good for pineapples. Pawpaw. These are good fruits all for vitamin C. Now, apart from those, vegetables too are good. The vegetables which are good on vitamin C, and sometimes people don't know, are chilies. Chilies. The chili pepper or even sweet pepper. There are those chilies which are sour and also some which are sweet. Both chilies provide a good source of vitamin C. Cauliflower, broccoli, those kinds of vegetables provide a good source of vitamin C. So vitamin C, very, very important. 2, vitamin A. Vitamin A, where do you get it from? Vitamin A, and vitamin A helps to strengthen this mucosa where this virus enters from. The skin lining, this delicate skin lining inside your mouth, inside your nose, vitamin A is important to make those linings stronger. Again, you can get vitamin A from carrots, pawpaw, those yellow fruits. This is, I think, the one area where yellow is helpful. The yellow fruits have a lot of vitamin A. So carrots, pawpaw, oranges have a lot of vitamin A. Eggs, again, you can have eggs and they will provide that vitamin. Now, vitamin E. Vitamin E is again very important, and you can get vitamin E from ground nuts and other types of nuts, the nuts, avocado, and we have a lot of avocado in Uganda, vegetable oils, oil from vegetables, oil from sunflower, oil from soybean, or even oil from corn. These are good sources of vitamin E. Then, last of the vitamins that are important that I want to mention is the vitamin Bs. So vitamin A, vitamin B, vitamin C. You can't forget those. A, B, C. I only started with C because it's the most important possible in this area, followed by A, followed by vitamin E. Again, vitamin E can be got, as I have said, from nuts, from avocado, from vegetable oils. Now, equally, I mean, that's vitamin E. Vitamin B can be got from millet, and that's why millet porridge is very important. From millet, from beans, from avocado again, from bananas, from meat, from dairy products, milk, cheese, yogurt, and from eggs. Now, having said that, in these also you will find folic acid and zinc, equally important in the immune system. Now, the reason I am talking about these nutrients is because indeed we need to talk about how we facilitate our people to access what will boost their immunity. How do we, you cannot just talk about avoiding getting disease when people are weak. We must talk about how to deal with this crisis through supporting our people to get immunity. And part of the support is information, but the other part of the support is actual ability to get what they are informed of. And this is therefore why I consider that on top of the measures that have been talked about by the various sources, in our country, Uganda, we really need to focus on how to support especially children and the elderly who are inherently more challenged, but also to support ordinary Ugandans to raise their ability to fight. And that is to do things that will reduce their stress, that will give them enough time to sleep, that will give them exercise, that will promote their wellness. This is the time to focus on each other's wellness. Because indeed, if we don't focus on each other's wellness, the suffering of the other people will come to us, those who think we are okay. It's absolutely important, and maybe this disease is God sent to make sure that we care for each other, that everybody is able to survive. Because whoever is not able to survive will easily pull that one who is able to survive down. And that's why, apart from the interventions that I have already talked about, which were mainly to deal with the spread of the virus, removing taxes on those things that people need to live and so on. I think it's absolutely important that we have a national conversation on interventions during this time to save all our people, especially the most vulnerable. And some of the suggestions that I'd like to present, and again, this is an area where I think all citizens should contribute, because this is not a technical area. This is a social area, a social economic area. It's not medical. How people become able to fight is not medical. It is social economic. So some of the things that I think need to be done, apart from the direct interventions we talked about, I think we need to get some doctors to where doctors are not. The UPDF, it seems they have many doctors. I don't know how many doctors they have, but when doctors were on strike, I had a threat to deploy military doctors. This is the time where such doctors can be helpful in areas which are poorly served by healthcare systems. I think military doctors should quickly be dispersed to areas to provide this information, to work with the people to get out of vulnerability. Secondly, I think it's important to declare centers in the districts. I haven't heard this. To declare centers in the districts where people who need support can get support, and indeed where support should be sent to help the elderly, to help the vulnerable children, to maintain their health in the manner that I talked about, to remain able to fight disease, to have nutrition, to have hygiene, to have those things that they ordinarily need. Similarly, to have centers for those who are suspected to have the disease. I haven't had designation of centers where if I suspect that I have a disease, I shouldn't walk to the clinic where others are and cause problems. I think there should be specially designated areas, either of health facilities or even specially set up to deal with those who are suspected of having the disease, and indeed to manage those who have the disease. This is especially important in the districts because, again, that's where there is huge challenge in respect of these areas. I have already talked about the management of areas that are going to remain for some time crowded. For example, those market areas, I think we should consider, rather than congesting all these places in the markets, I think we should consider opening up other areas where people can easily access market items. In other words, because markets are few and congested and people must go there, let's have temporary markets set up, managed of course with the same guidelines, but which decongests these markets, and again, like I said earlier, facilitated with the hygiene materials that they need. Now, We have talked about the stressful situations during this time. We really must look at income, because income is going to collapse on the part of many people. And income has already collapsed for many people. Those who are engaged in import, export, those who are engaged in the industry of tourism, whose income depended on tourists coming and things like that. These are people who are immediately going to find themselves totally lost in terms of income and extremely vulnerable. So I think it is important that special measures are made to safeguard people's incomes and people's businesses. I have not had any specific measures out there being suggested, and I think the whole country needs to focus on this area and suggest these measures. The reason countries have reserves in their central banks is to deal with emergencies like these. If we don't have a reserve, we don't then possibly consider ourselves as a country that is well managed. But whatever reserve we have, I think this is a time when it's rightly drawn down to support citizens to get out of the tough times. To that extent, I think to support all people who are striving, all means of reducing interest on loans must be undertaken equally immediately. And the central bank can have an influence on this, first of all by reducing its own lending rates, but also by engaging with lending institutions. Secondly, there has to be a centrally driven restructuring of credit that is available to people and businesses. At any rate, apart from restructuring, I think it would be unfortunate to recall loans during the pandemic itself. I think loans should not be recalled during the time of the pandemic, so that there is less stress, there is more money available to people to fight for survival. Similarly, I think those who rent where they sleep, there should be, again, both a popular call, social call, but also state-driven call to landlords, wherever they are, to restructure rent obligations on the part of our people during this time. And at any rate, not to evict people who are unable to meet their obligations during this time. Because again, that will intensify a crisis that we are dealing with. So again, I think there should be guidelines and even regulations relating to this matter. Lastly, I think there should be tax waivers or tax holidays on businesses that are especially vulnerable because of what is going on. I have already pointed out those who are in the service industries that are directly hit, in the tourism industry, in all its ramifications, in the transport industry, because we are moving towards lockdown. If you lock people from moving, that means the transport industry is directly hit. In fact, the air industry is already in extreme crisis. Those in restaurants and others. I think the important point here is that there has to be a special effort to cause tax relief and business support for all our people so that businesses survive. Just like we want people to survive, our businesses must be helped to survive the crisis. And this will require a direct and critical intervention of the state. These are some of the areas I thought are important to raise as we all continue to grapple with the serious challenges that we have at hand. We need to hold each other's hand, to support each other to get out of this crisis. But as you know, our campaign is a campaign of self-defense. Even when the central support that we expect from government is not there, and quite often will not be there, let every citizen hold the hand of another citizen. Let's defend ourselves. This is the campaign that we have been conducting for some time of 12-1 echo. This is where it is very relevant. We need to defend ourselves. Even when we have no support from elsewhere, let's defend ourselves. Let our comradeship, let our brotherly and sisterly relations become as strong as possible at this time. Thank you very much, and God bless our country.